in the frontline therapy, but I cannot stand in court and defend my decision. Thank you.
In the Bolero study, we did have patients that had been treated in the adjuvant setting and were then progressing. So therefore, I think this patient does fit into that particular setting.
Within 1 year.
Yeah.
And final question from Dr. Sanaso. Okay.
Thank you both for a very interesting debate, though I am with you, Dr. Apro. However, I'd like your opinion. You gave the option of exemestane and everolimus as the better option, considering the data with, fulvestrant and exemestane being more or less like equal and edgy. How do you interpret the data considering the most recent, data confirming a 500 milligram dose as opposed to the 250, which we had all the data with before? This patient has a lot of options. So, what would you offer her? Would you have offered her the 250 dose or the 500 considering the most recent data? And we're all convinced this is the optimal dose. That was underdosing when we were using the 250.
Well, the study, the effect study started with 500. And then the data we have from Sophia is not showing very, very impressive data. It's still a few months of these patients surviving without progression. Here we are speaking about a year. What I would agree with everyone is that we want to see the survival data as ultimate data, but registration authorities have decided that was not needed.
Why do you consider progression within 6 months of stopping hormonal therapy resistance rather than hormonal dependence, considering that we are extending the treatment?
Well, as you know, I think it's a very important question you are asking there. It's the same thing for chemo resistance. We have, for study reasons, to decide that this certain period doesn't mean anything. What we need, and we will have in the future, is that when we look at the biopsy, as was done in this particular patient, in the biopsy we'll be able to determine whether or not the resistant pathway is activated or not.
Thank
you. Thank you so much, Pierfranco and Matti. It was a very fabulous discussion, actually.